I'm Deborah Rennick. I'm Partnerships Manager for Elemental. As you can tell from the accent, I don't come from Derry. I live over in the northeast of England, but I cover the whole of Scotland, north of England, in Isle of Man. I'm hoping that John Loughton from Scran Academy will be joining us before his session later on. But if I can just leave and hand over to Danielle and Claire and Karen and Sean to introduce themselves, that would be great. Thank you. So Danielle, if we start with you, please.
Thank you, Deborah. So my name is Danielle Keenan and I'm the project manager for Spring Social Prescribing. I am from Derry, but I'm not in Derry today, so thankfully I have been able to connect. So it's great to be here and I'm looking forward to the webinar. Thanks,
Danielle. Claire?
Hi folks, I'm Claire Cook and I'm the Social Prescribing Regional Manager for Scotland. So I'm employed by Scottish Communities for Health and Wellbeing and I support the 10 organisations we have here in Scotland.
Thanks. Karen, please.
Hi, I'm Karen Haldane. I'm CEO of Your Voice in Inverclyde. We're one of the 10 projects in Scotland and I'm delighted to be here today.
Thanks. And finally, Sean.
Thanks, Deborah. Hi everyone, I'm Sean McFarlane and I'm the Social Prescribing worker for Spring Project and I'm also involved in the Community Connector Project and I work here at Your Voice in Inverclyde. Thanks.
Marvellous, thank you. So the format for this afternoon's session, so we're going to have an introduction to what social prescribing is for anybody out there in the audience that doesn't know what it is. We're going to look at the benefits of embedding digital to support social prescribing. We're going to look at how Elemental works, and then we're actually going to take that customer focus and hopefully hear stories from the Scran Academy, Spring Social Prescribing and Your Voice Inverclyde. And then, as I say, at the end, if time allows, we'll run through a question and answer session with you all as well. So we'll start with the Elemental story and what is social prescribing. So it's lovely to see a lot of you on this afternoon session for taking time out of your busy day to attend. I'm going to spend a little bit of time setting the social prescribing scene and demonstrate the benefits of embedding a digital solution and explain who and what Elemental is before handing over to the people you've really come to listen to this afternoon, our customers. So the Elemental story starts in 2013. Derry is the city of culture and health and wellness are a major feature of this. Jennifer Neff and Leanne Monk are community development workers in the city and come together for the first time. They're keen to reach out and promote all of the wonderful services available to the people of Derry, but don't know how to do this well. So they come up with an idea of making this digital to connect the city. Today, we're a team of 32 people who genuinely care about community health and well-being and want to stop health inequalities in communities across the UK, Ireland and beyond. Elemental was set up for 3 reasons. Firstly, people need more than just being handed a leaflet and told to exercise more, eat well and get a job. They need to be connected into their local communities and supported by those who can help with their social and well-being needs. Secondly, there's lots of support out there. People just don't know about it or how to engage in it. And thirdly, we know the true impact of connecting people to services such as community-based mental health services and social welfare, but this isn't always fully appreciated. And while tech shouldn't be the dominant force, it has a massive role to play in this. Social prescribing isn't just about signposting a person to a service or intervention or health coaching the individual or having access to a directory of service, and certainly isn't just a way of filling in somebody's time. It's so much more, and the services and interventions available grow almost every day, as does the complexity of needs of the clients. Some clients may require very little support and just need signposting or advising of a local knitting club to help with their social isolation, whereas others may have more complicated needs and require several interventions spread over a longer period of time. So in simple terms of what Elemental does, we connect people and services. We offer a referral channel, whether that's through integration with a clinical system, a standalone platform, or via our own self-referral module. We provide a directory of service, which allows link workers and their clients to understand and engage with the interventions and services that are available to them. And finally, we provide a full reporting suite, including measurement tools and reports to monitor the uptake and impact of the services and the interventions offered. Elemental was founded to help join up the many component parts to social prescribing, including promoting better partnership working between agencies and organisations, contributing to a reduction in social and health inequalities, maximising the impact of health population management in and around the communities in which we live, have the patient at the centre of all decisions made about them, and demonstrate the impact that organisations, services, interventions and link workers have in supplying healthier behaviours and lifestyles. The Elemental platform helps our customers tackle many challenges they face, regardless of the type of organisation they are. For example, establish a robust list of all local services and interventions available, support quality assurance on suppliers and providers, allow link workers and patients to track and monitor progress, provide an easy referral process, and track the project outcomes to prove value for money. So who uses Elemental? We classify these into 5 key headings. We have referral agents, GPs, social workers, paramedics, housing officers, and many more use Elemental to refer their patients, customers or clients in. Referral handlers, i.e. your social prescribers, your link workers, your development workers, they've many names, but regardless of job title, they are the people who work with a client on a person-centred plan, track improvements and prescribe or recommend interventions or services. You've got the providers, those who are providing the advice or service to the patient, use Elemental to promote their services, log attendance, and in a lot of cases help to maintain the validity of the directory of service. You've got the clients themselves who can use the self-referral module, monitor their key stats and review and log attendance at upcoming classes, services and interventions that they've been referred to. And finally, you've got the super users. The commissioners or managers can have access to our extensive suite of reports to help monitor caseload, engagement and impact. We support customers from a variety of sectors, including but not limited to local government, universities, prisons, charities and housing associations. This slide shows how we support from very large economies to the smallest of customers, from a regional deployment like we have in Greater Manchester to smaller organisational deployments. Most of our larger deployments started as smaller projects and due to their success they grew into something bigger. Our deployment across West Lancashire started as a small PCN deployment in Skelmersdale. Our Greater Manchester deployment began in Tameside and Glossop and grew and now includes the likes of Ingeus, who are providing employability support not only in Greater Manchester but other areas as well across the UK, and they again use the Elemental platform to support their work. We measure the uptake we have on the client and the wider community's health and well-being via a suite of measurement tools available within the platform. We can use our inbuilt dashboards to monitor the progress of the client's journey. We can review the impact we have via our suite of reports, which can help us identify things like common reasons for referral and gaps in service provision that would help our clients and their customers. And we can measure our data against other organisations' data via our extract tool to fully understand the impact we're having against the wider community, i.e. reduction in GP appointments, in A&E attendances, hospital admissions and waiting lists. I mentioned earlier the types of organisations who use the Elemental platform, but this map shows us where those customers are in the UK and Ireland. This number continues to grow and the areas covered continues to spread. I've specifically listed out the customers in Scotland, some of whom you'll be hearing from in a little bit. So I'm just going to highlight some of the key figures in this diagram, which demonstrates those being connected and supported by Elemental. We have 7,429 referral agents using the Elemental platform to refer their patients into the link workers. We've got 1,284 link workers using Elemental to support their clients, and 62,225 clients are being helped through the Elemental platform. We do release figures on this on a monthly basis on Twitter and LinkedIn, and it's staggering how quickly those numbers actually grow. So how does Elemental work? We're going to look at Oliver's journey. Oliver's a 50-year-old man who was widowed and recently suffered a stroke, which affects his speech and his mobility. His family don't live nearby, so he feels socially isolated. He needs help with his motivation levels and exercise regime and is experiencing mild symptoms of depression and anxiety. So he visits his GP, who refers Oliver to the local link worker. They pick up the referral and make an appointment to see Oliver, where they take some baseline measurements, and together they work on a wellbeing plan, which results in Oliver being prescribed into several local services, such as the local men's shed and a walking club. Oliver attends regular reviews with a link worker, and they retake the measurements, and extra support is given until a point where the interventions prescribed have a positive impact on Oliver, resulting in an engaged, activated, empowered, immobilised patient. So to finish off the Elemental story before I pass over to some of our customers, we've got some fascinating stats here that show since COVID first hit us, the huge increase in numbers around our users. So there's 20,000 more patients being managed and supported in an Elemental platform since March. 516 more link workers are using Elemental, and 3,209 more referral agents are using Elemental. So that's who and what Elemental is. I would like to say that's back to Serena to move us on, but that's back to me to move us on. And I'm going to pass over now to John Loughton from the Scran Academy. Afternoon, John. John, you may just need to unmute yourself.
I'm hoping that button has solved the problem.
That's wonderful. Hi, afternoon, John.
Hi there. Hello. How long do you want me to speak for, Jennifer? No, Deborah,
it's yes. Sorry, yes. 10, 15 minutes. However long.
Fabulous. I've been on this call for probably 45 seconds. I've just made it in time. I had a bit of a wrestling match finding the link, but I'm here. So good afternoon, everybody around the country. My name is John Loughton. I'm the founder of a social enterprise in Edinburgh called the Scran Academy. And we've been working with Elemental through that organisation for a number of months, but I've known Elemental for over a year or so now in different guises with different organisations. So it's been really good to connect the work I've done with Elemental and social prescribing on a bigger scale to really seeing it hit the ground running. In this example is a complete response to supporting a small organisation manage the overnight need that emerged through the kind of COVID-19 challenge that presented us. I know there's some slides here. I'm not actually going to really speak to them a huge amount so people can read ahead, but Scran Academy is a social enterprise which essentially exists to support young people with the most complex and challenging life's needs and circumstances to change their own lives. We're not just a standard charity in that sense, because we believe in helping young people empower themselves to trade their way to change their lives through catering events, and we help develop a whole suite of soft skills and personal social development through youth work and community-based contact. So like so many community-based organisations, we sometimes find it hard to tell our story and sell our impact. The Elemental software has been a really important tool in our arsenal to help us really seamlessly capture, track, understand, update and transition our young people's journeys of kind of social progress, if you like. We're a very holistic organisation that creates development and change and impact in a range of different ways in a very broad sense. So actually, sometimes community workers and youth workers and the kind of stuff we do, we're a wishy-washy, feel-good bunch of folk. So to have a tool like Elemental, which helps facilitate also the mindset and the thinking of us as practitioners, is really helpful for us to very fundamentally track the presenting needs and have a kind of forward-looking journey with our young people. We at this point are very new to Elemental, so I think it's probably worth admitting or saying we know we haven't unleashed the full potential of this approach in terms of how we use our information and data, in the sense that we've not really made our software speak to a whole range of other organisations locally quite yet. So it's been actually for us on a very basic level a very powerful internal tool, but to even understand the presenting needs and the different factors coming in has been really important for us. We work very closely with a range of other organisations, and more so this year than ever. We had 2 part-time staff members in March. We now have 7 full-time staff members, and we've onboarded a team of around 250 volunteers. We merged with another organisation, taken on a community cafe. We've just taken on board a full-time industry catering truck where we deliver meals right around the city. And so alongside our traditional kind of 2-day-a-week alternative school programme, where young people who are not thriving in school come to Scran Academy, we found ourselves running a citywide meals programme for those most at risk of COVID-19. We're sitting at about 125,000 handmade meals produced and delivered around the city. So our ability to track and project our outcomes has been very important. For me, where this gets very exciting around where this is going, particularly in Scotland, is I just think we're kind of hitting the tip of the iceberg in terms of understanding how social prescribing can make a difference very specifically to the social landscape in Scotland. And I say that on a couple of fronts. One, and I think it's a UK-wide challenge, lots of us in the voluntary sector are still banging our heads off walls trying to be heard by government or seen as capable as the kind of private sector. So there's something about trying to create a parity of esteem where we can create a really seamless dialogue digitally with other big services, the main one being the health service, but you know, maybe education service and others, where we can start to see that seamless referral model where you know, the statutory sector can refer into us a lot more straightforwardly. And I think that's going to be really important for us helping to sell the impact we have. You know, we all know in our hearts that it's better to socialise, engage, empower and love and use relationships to create changes, as opposed to you know, somehow surviving, if you like, just through medical solutions. So that's been a really important part for us. And it's also helped us start to be really clear about the health, education and employability outcomes that we as a small organisation that's going places in a hurry has been very important to help us do that. We know we're good at what we do. We see the vast majority, about 80% of the young people that come through our doors go on to access further training or jobs directly, which is a really important thing for us to see the young people transitioning to these destinations. And we've already found ourselves using Elemental to streamline with a referral process. So there was bits of paperwork that were annoying that, you know, teachers in schools or social work departments were having to fill in. We can join that up now, and that helps, and we can pull reports and pass on information as feedback very quickly to our referral partners in our instances. Another thing that's quite important is so often we get bits of funding to do mental health work, or we get a bit of funding to, you know, tackle the scourge of smoking, or to do anti-poverty targeting, or to get young people into work. It's very narrow-minded bits of funding often for outcomes. And what Elemental does is enables us to track a whole range of outcomes and progress simultaneously, and capture actually the very truest nature of what we do as a voluntary sector, as a youth work organisation, and that's to take that kind of cross-cutting approach at all points. We can help monitor that. So for us, that's been very important. We do have good relationships locally with the local Edinburgh Health and Social Care Partnership. We do have good relationships with local education and social work sectors. I'm very interested to learn, again, how do we continue that journey? Again, we're very, very new. It's helped us respond in a very big way to see huge transformation as we've merged, as we've upscaled. It's been really important. So that next stage for us remains very, very exciting. But it's helped us tell the story of the power of that very fundamental principle for us of social prescribing, which is it's a core solution to starting to tackle some very deep problems in Scotland, and that's that idea of stop filling people with antidepressant drugs, stop sticking them on dodgy tablets, stop just, you know, batting them away, stop sending them straight to GPs. There's other things in the community which is really life enriching solutions, and social prescribing in my mind is a really important tool to helping get on the front foot a lot of these issues for young people, and that we're very excited to see how we continue to use this as one of the tools in our box to kind of sell what we do, be better at demonstrating our impact, and ultimately scale. The core of this is it helps us have a stronger, more clear relationship in terms of our outcome measurement and improving with larger statutory organisations who work in a far more methodical way to kind of very small organisations that perhaps haven't had the infrastructure in place to churn out these reports in the way that maybe some of the big players would find more comfortable. So that's a wee brief kind of summary of where Scran Academy's been at with the software.
That's fantastic, John. Thank you. I'm just going to move down the slides. They're being very slow in responding, but we've got Claire and Danielle next from Spring. Marvellous. If I just hand over to yourselves, please.
Thank you, Deborah. So I introduced myself at the start. My name is Danielle Keenan and I'm the project manager for Spring Social Prescribing. And Spring is quite a big social prescribing project. It is run across Northern Ireland and Scotland. So I'll just give you a wee introduction as to how we started off and how we actually came together and what we do and how our model actually looks. So back in 2015, the Bogside and Brandywell Health Forum and the Healthy Living Centre Alliance developed a social prescribing pilot programme, and likewise the same activity was happening in Scotland with the Scottish Communities for Health and Wellbeing. So there were two quite similar pilot programs running in both areas, and basically we came together and we developed a collaborative partnership. So the Spring project is operational across 24 different communities. There's 10 in Scotland, which Claire supports very closely, and then we have 14 in Northern Ireland as well. So we have a team of 38 social prescribers, and that's a combination of full-time and part-time as well. We've been operational from January 2019, and within that short space of time we have connected with and made links with over 100 GP practices. So we basically, the model was set up to accept referrals from GPs and health professionals, and I suppose really the reason that we didn't go down the self-refer route is that we were really trying to build the link between the health professionals and the community. So that's how the model was set up. So if you just move on to the next slide, Deborah, please. Okay, so this is a wee bit small, but I'll talk through it anyway. So this is our health pathway. So basically, to put it into context as to how the Spring model works, if a patient presents to the GP, but their needs are not medical, it's more of a social need or maybe some emotional support, the GP will refer the patient to the social prescriber. So the referral can come from the GP, health professional, or a pharmacist. So the referral comes through to the social prescriber, and the social prescriber is based within the community. So it's a wee bit different to how the link workers work within the GP practice. So the referral comes through to the community, and the social prescriber will connect with the client. And generally they would spend about an hour getting to know each other and finding out what matters to that individual person. So once the social prescriber and the client, they meet up, or at the minute they're doing it over the telephone, of course, adhering to the COVID guidelines. So once they establish that relationship, it's really trying to find out, you know, what matters to the person, and what needs and what types of support they may need to engage within their community, whether it's a walk-in class or a swimming group or counselling sessions. You know, they find out what is relevant, and then they co-create a health pathway, and they set some targets and some goals, and the person then engages within whatever support is suitable for them. So when the person goes through the journey, the social prescriber supports them throughout. You know, it's not a matter of, you know, there's a walking group on a Tuesday, go along and see how you get on. You know, there is ongoing communication and support throughout the individual's journey, you know, throughout the project. At the end of the project, then the client will be encouraged and supported to maybe move on to other volunteer opportunities, and then we would provide feedback to the person that made the referral. So throughout that entire journey, then we use Elemental through every step of the way, from the referral to the first meeting, to the follow-up meeting, logging through the interventions, and then, you know, the feedback and the outcomes for the person as well. So that's just a look at our specific community-based social prescribing model, and I'm going to pass on to Claire now, and Claire is going to talk about how we specifically use the Elemental platform, the benefits to the social prescriber, and the benefits for the managers using the platform on the other side.
Great, thanks Danielle. Deborah, can you move on to the next slide? Thank you. So I'm just going to spend a couple of minutes just to let you know how Elemental works for us. The platform has been tailored specifically for our Spring programme, so that's a benefit to us as well. So as Danielle said, we have over 100 GPs and health professionals that refer in. Now quite a lot actually refer in digitally, so they use the Elemental browser. Elemental is integrated with EMIS Web. However, none of our GPs in Scotland have chosen to integrate it into that model, and I think it's because there's a cost attached to it. That cost goes directly to EMIS Web, it doesn't go to Elemental. So the professionals, the GPs, they're happy enough to just log in through the browser. We also do accept paper referrals, but we do promote referring digitally. So some of the benefits for our social prescribers is that they can track and monitor the progress of their clients throughout their journey. So there's lots of different tabs available within Elemental. So our social prescribers record case notes, they record the interventions, the type. They also set goals with their clients as well in different tasks. So that's all recorded on their system so that we can track the journey of a client. Some of the other functions that are available is that they can record the type of contact as well. So things such as telephone, visits. Obviously during COVID-19, our visits and attending group work, that was stopped like everybody else's. So the telephone support has went up, and we can see that on our platform. It's all bar charts, so it's really, really easy to read off the system as well. So some of the benefits for the management team. So in terms of referrals, when I log into the system, I can see where the referrals are coming from, which area. So as I've said before, I support the 10 organisations across Scotland. We can also see the age of the client as well, the gender, The case status as well, so how many active clients do we have, how many are waiting, how many have been complete, and how many have disengaged. So that's really useful information to track across the project. In terms of interventions, we have created a set of categories. So these are things such as mental health, physical activity, social groups. So we have a list of categories for our interventions so we can track the different trends and the types of interventions that our social prescribers are referring people into. And the biggest thing for us, and I'll just echo what John had said previously, is that we're trying to demonstrate the impact. So we're funded by the National Lottery Community Fund, so we need to prove our worth, and this is where Elemental comes in really useful for us. So what our social prescribers complete the short WEM webs with their clients, and they use the Wellbeing Star from Outcome Star, and this is all tracked on Elemental as well so that we can see that process. So that's really useful for us when we're gathering data so that we can feed back to our management and the funders as well. So thanks, that's us from Spring.
Marvellous, thank you. And we've now got Karen and Sean from Your Voice Inverclyde. I'll just, technology, move on to their slides. Over to you guys.
Hi, good afternoon. I'm Karen Haldane and I lead Your Voice in Inverclyde. So I'll start with providing a short overview of our agreed referral pathway, which we developed with our local partners, and this links with the Elemental system. And there's a diagram on the screen which you should all see, and then I'll pass you over to Sean, our social prescribing coordinator. So at Your Voice, we deliver 3 social prescribing projects. We deliver a Community Connectors project on behalf of the Health and Social Care Partnership, the Macmillan and Phone Connect project for people affected by cancer and life-limiting conditions, and the Spring Social Prescribing project. All of our projects are community outreach based. We also deliver a people involvement advisory network, a lived experience network, which is working with people in recovery from addictions and mental health issues, our care experience young people, feeding into our Champions Board, and our New Scotch refugee integration work. All of this work feeds into our Your Voice network to ensure that local services meet the needs of local people by highlighting and addressing the gaps and challenges. Our social prescribing team work very closely with the community links workers who are based in all GP practices across Inverclyde. We organised a joint team development session using the RAFI matrix, looking at the 4 key responsibilities: responsible, accountable, consulted and informed. The aim of these sessions were to provide clarity and understanding of the roles and responsibilities, and for all the social prescribing, community connectors, links workers all working together to achieve the best outcomes for local people. So that session involved the teams producing a day in the life of, so sharing their typical day through short films or just verbally talking on the day. We then explored the roles and responsibilities for each and split into 2 groups, mixing the staff teams up in each group. And collectively, the group looked at the distinct differences and unique about each other's roles, and then clarifying the similarities and differences and identifying the unique contribution of the teams. The key differences between the community links workers and the outreach-based social prescribing team were the crisis work for the community links workers, whereas prevention work for the social prescribers. The links workers being GP-based and the social prescribing team at Your Voice being community-based. The links workers working with more long-term intense support, whereas the social prescribing team at Your Voice was more light, short-term support. So the teams together used their knowledge and agreed this decision criteria for referrers and the pathway, which you can see on the screen. And the outcome of that work was a coordinated approach for improved joint working processes, ease of referral and quick action, improved access both within GP practices and out in communities across Emma Clyde, and more importantly, improved outcomes for those being referred, ensuring people were connected to the right people, the right service at the right time. And I'll pass you over to Sean now.
Lovely. Thanks, Pam. Just the next slide there, please, Deborah.
Yep.
Magic, thank you. Hi everyone, so I'm Sean McFarlane, the Social Prescribing Coordinator based here at Your Voice. And I thought I would take an opportunity today to just really explain about the key features that we use as an organisation using the Elemental platform. We use it across a few different projects. In particular, I'm responsible for delivering the Spring project, so we've been using Elemental for the past 2 years, and also the Community Connector project, which the team have been using the Elemental platform in the past year or so. So the first key point is evidence, and it's something that we've historically wanted to capture on my previous database, and that's evidence in people's positive health journey of change. The platform, it allows us to do this. We use the short webs and who comes there, the wellbeing stuff, and we also track GP and hospital attendance, so we're actively asking people these questions. So we can clearly track in the evidence outcomes, and in most cases positive impact and positive outcomes that social prescribing has, not only for the person, for the client, but for statutory services as well. It was a key theme of the day's presentations, as commissioners and local authorities, people want this evidence, funders, they want to see this evidence. So the platform is great for capturing that. The next point was accessibility. So obviously with the COVID-19 pandemic and the current situation, our team here at Your Voice, we're working remotely, as well as a lot of other people are. And the platform, it allows us to do this. Even before COVID, we were able to use iPads, so we were able to go out in the community. We were able to update client case notes, we could complete assessments, so we could do that remotely as well, thanks to the platform, which has got that function being cloud-based. The next point I had noted was the robust referral process. And to be honest, when I first started using the Elemental platform, this is one of my unique selling points when I was initially introducing it to GPs and other professionals. And it was the fact that referring agents, people could make a referral in under 60 seconds. So it frees up a lot of time. And as we know, a lot of GPs, they've not got a lot of time. So this was, as I say, my unique selling point, was selling it to them. A referral can be made in under a minute. I think it's also good the fact that the platform, it notifies you by email, notifies the team when a referral's been made, which is another good point. And I remember when I first started using the Elemental platform, when the referrals were coming through, I was getting excited, because it proved that it works, and it was live, and it all linked together. The more and more referrals I get now, I don't get as excited, but it's good that it works. The next point is that it allows multiple senders in multiple hubs. So as Karen had mentioned earlier, we've got 3 hubs here at Your Voice that we're actively using the Elemental platform. And I know Claire and Danielle have touched on it. It's great for evidence and reports and different outcomes on the specific projects that we deliver. The second last key point I had was the case overview. And I personally like the fact that on the home screen of the platform, the status of each individual is colour coded, and it allows us to change an individual, their journey to where they are at their journey. So whether that be green for active, or blue for complete, or waiting, etc. For me, it's a good quick indicator, the more and more clients that we've got added to the platform. And the last key point is just the help desk that Elemental operate. It's a great wee support for any questions or any queries that we've got or any issues with the platform. And when we get in touch with them, they're generally good at getting back to us right away. I don't bombard the help desk as much as I did when we first started using it. and I'm sure they'll be glad of that. But it's great that you've got that option of a wee bit of support if required, if any issues. And that's about me, Deborah, thanks.